Good evening, Prof. It's always great to chat to you. Let's talk about this 10,000 new infections in one day. That is very worrying indeed. The two provinces that are bringing in the highest numbers, the Western Cape and KwaZulu-Natal, how concerned are you?
Good evening, Sally, and good evening to all of the viewers. We are now at this stage in all 9 provinces experiencing a rise in cases. So the second wave now is well and truly national. We are seeing in the Western Cape more cases now than we did at the peak of the first wave. So there is really a concern that our second wave is going to be substantially worse than our first wave. If we look at KwaZulu-Natal, the rate at which the numbers are increasing is far faster than we saw in the first wave. So all in all, our situation at this point looks like our second wave is going to have a bigger impact in terms of more cases than we saw in our first wave.
So that's very worrying. Do you support the full season beach ban in the Eastern Cape and the Garden Route because of this?
When you look at the beach situation, you can argue cogently in either direction. There's a good case to be made for keeping beaches open. There's a good case to be made for keeping them closed. I think the fundamental issue is that an open beach that's not crowded is not a problem. It's the overcrowding at the beach that presents a problem. And given the rate at which cases are increasing, an overcrowded beach, especially if you take Durban Beach on New Year's Day, where we have close on to nearly 250,000 people, that would be just, it's just a disaster waiting to happen. So we have to do something about that. And so I think they've been trying to find a very careful balance because there's no easy answer to that question. I've been broadly supportive of closing the beaches if you are not able to keep the numbers under control.
Which seems to suggest that, and you've told us before, that beaches, of course, are always windy places to be, that sunshine helps destroy the virus relatively quickly. And it seems to suggest then that you might be more in favour of doing what is being done in KwaZulu-Natal, that on those high days and holidays, when we know it's traditional to go to the beach for a day of fun, close the beaches then. And that is exactly what they want in the Garden Route. Do you think that the balance is incorrect, perhaps, in this regard? Because I know you're a scientist, I know you look at the medical facts, but you are also extremely cognizant of the massive economic impact.
So I was quite concerned that if you looked at Durban, and I'll just use Durban as an example, that on our crowded days, we're really looking at a situation where people are right next to each other and they are packed like sardines. When you have that kind of situation, even though you're in a situation of the open air, even though you have sunlight, you are breathing what other people are pouring out. And so it's a very high risk situation in that setting. I would strongly favor any approach that tried to keep the beaches at a nominal number of individuals so that there is some social distancing. We accept that mask wearing is not feasible on the beach, but at least that there's some social distancing. And I think if that's feasible, I don't see a reason why we should be concerned.
Okay. Vaccines are starting to be given in the United Kingdom and the USA, among other countries. But we've heard a report today that Southern Hemisphere countries, led by India and South Africa, have asked for a suspension of the World Trade Organization patent rules so we can basically make cheap, generic versions of the vaccine. But apparently, Britain and other rich countries have said no. So does this mean that despite the AU grouping that the President has spearheaded and the COVAX plan to try and get vaccines to South Africa and countries similar to ours, that we really are at the back of the queue?
So I think the effort from India and South Africa is quite an important one because it's not specific to just this coronavirus epidemic. It's about laying the foundations for pandemics in the future. If we look at, if we have a situation, let's say that a vaccine is made and is shown to be safe and efficacious, and that its intellectual property is not protected, we actually do not have the capability to manufacture most vaccines in South Africa. So even if intellectual property rights were not protected, we simply do not have that immediate capability. We would need the original company to do a huge amount of technology transfer in order to do that, and they would have no incentive to do that without protecting intellectual property. So I think it's not something that we are looking at as an immediate solution, but it's a good foundation to start with for the future. Right now, we have something like about 13 vaccines that are in advanced clinical trials, 5 of which have already released some results, 2 of which have released final results. So we are expecting at least another 8 clinical trials to release results. So in the next few weeks, we will have quite an array of different vaccines, and we will then have to make a very careful choice, and one that is strategic in choosing the one that is most appropriate for South Africa, so that we don't choose a vaccine that has very stringent cold chain requirements and so on. So I think that's where our key next step has to be, choosing a vaccine candidate wisely.
I cannot let you go without congratulating you on a very well-deserved international award that you've received for your work this year. You and Dr. Anthony Fauci, who's the director of the National Institute of Allergy and Infectious Diseases in the US, you've been jointly awarded the John Maddox Prize for this year for going beyond the line of duty as government advisors on health. What does an award like this mean to you?
Well, I was quite taken aback when I first heard of the award because I didn't know about it. And I was overjoyed when I learned that I was receiving the award, with my friend and colleague of more than 2 decades, Dr. Anthony Fauci. And I think for me, it's a symbol of the importance of science. And the COVID epidemic has put science on the front lines. And there are so many people now who engage in terms of science and who are actively involved in understanding science. For me, it's just a wonder to see how much science has been democratized by becoming so accessible, where you can have the numbers every day for the whole world just by going to Johns Hopkins University website or World in Data. I think we have seen a new kind of openness and a new kind of way in which science is influencing our lives.
Well, you certainly played a vital part in that, and congratulations and thank you for all the conversations this year, all the reassurance and all the breaking down of difficult scientific concepts that we've all needed to understand in these unprecedented times. So thank you so much.